Good morning. Bob Ravenscroft, Vice President for Advancement, here for our Thursday press briefing. Before we get going, as we mentioned, we're going to back these off to once a week, and we have selected Thursday. Thank you for your feedback. There was also some questions coming in, not from the media, but from the people who follow along by Facebook on how they wish we weren't doing this and backing off. I just want to put a little teaser out there. There are going to be a series of programs coming up that we will broadcast through Facebook Live. Right now, there's about 4 scheduled. They're going to be kind of one-on-one, sit-down interviews where the public can ask questions of the physicians that we're interviewing. The main focus of these is going to be on what people need to convince them to consider a vaccination. We know that there are some that are scared or skeptical or ambivalent. So what we want are many of the physicians who have spoken in this forum before will be the ones featured, and it'll be content that you can share with your family members, have some of your questions answered. So a little bit different focus. They will then be translated into at least 6 different languages, distributed through cultural centers and through other influencers. In fact, we have a ton of influencers, what we call influencers, on our own team, working in different departments who are connected to the cultural community. So it's going to be kind of a bank of programming that can really help bring or alleviate some of the anxiety around getting vaccinated, because as you've heard from the physicians, along with our masking, social distancing, and hand washing, vaccines are what is ultimately helping blunt the spread. We are committed to increasing the frequency beyond once a week should conditions on the ground change. And I guess, who knows what will happen with the new variants, or if there are changes to the vaccination allocation where we might play a more prominent role. Heaven forbid, if we surge again and things get a little tighter, we will come back for more regular media briefings. Would just add to the media, with this, we are absolutely open to the one-on-one interviews, which was one of the reasons we went to this forum in the first place. It was impossible to do. But if you have specific questions, contact our media relations department and we can get that answered. For the daily statistics, and we will continue to provide them, remain very busy here. Our midnight census was 535 patients. Thankfully, at this point in time, for our COVID patients, it's essentially 41 patients. That is, again, higher than what was causing our hair to start on fire back in June, but certainly significantly different than what we saw between the months of October and just until very recently. Of those 41 patients, we have 7 that are in our ICU, and 3 of those are on ventilators. And then if you break it down by county, you can see that it's reflecting numbers going down. The majority of them are residing here in Lancaster County, then sporadic throughout the state. So again, great job by everyone in the community. I don't know if you're seeing it. I am when I'm out and about a little bit on essential errands. The universal masking that is taking place across southeast Nebraska is vastly, vastly improved, and that's what's driving it. It's not the vaccine yet. It's not the therapeutical treatments that we have. It is the public stepping up and helping control the spread of that. That's a great question. If there is a natural place for them to slide back into an area where they once were, they'll go there, and then all of those employees have been made available or have been informed of other opportunities throughout Bryan. Certainly our hope is all of them will select to remain on and be redeployed in other areas. It's kind of an interesting question because we have received more doses, but they're not our doses. We're being used as a storage. Sorry, there was a siren outside there that seemed rather close. It's gone. So as the doses come in, we are as one place where they are being stored. So there are some doses here, but they're not ours. Then there's another chunk of doses that are, we received our allotment to take care of the people in 1A, and about 75% of our employees have received them. So that leftover, we're awaiting direction from the health department on where they want them redeployed to. So I guess the best way to describe it is we are a kind of a warehouse right now for storage. And then we're still following all health department guidelines on who gets it and how to distribute it. So we do not have clearance to take any of the health department's doses being stored here and vaccinate on our own. We are providing several different types of volunteers. Kind of routinely for the clinics, we have about 21 clinical staff members that help with the actual vaccination. We have 6 or so non-clinical members of our team at every clinic helping with some of the logistics. And then just with the temperatures out, we have, a courtesy car and stuff. So we're going to help the health department transport people from parking garages right up to PBA. No, not to my knowledge. We haven't. I did see a map last night. I forget where I ran across it about you either have the UK variant, the Brazilian variant, or the other one's escaping me, where it's South American. Or South African. They're across the country right now. There was nothing identified in Nebraska, at least on that map I saw last night, but different variants are, in Minnesota and Colorado and Kansas and stuff all around us. So I think you have to assume they're probably here at this point in time. And that's why, we've all seen the information where they think it could be more contagious than who knows on how it is from a mortality standpoint. But the one thing that we can all continue to do is, and that's why it's vitally important to continue with the universal masking and being wise with our social choices and hygiene.